This is Dubai Eye 103.8.
The region's favourite doctors, live and listening.
Doctor, give me the news.
On Afternoons with Helen Farmer.
It's all about health between now and 4 o'clock. And I've got to be honest, a subject I know almost nothing about, but luckily a doctor is in the house. Dr. Shabeeha Rana is joining us. She's qualified in the United Kingdom and she did her medicine and specialist in haematology. That's at Nottingham University Hospital. She's become a member of the Royal College of Physicians and then a fellow of the Royal College of Pathologists in London. And she's here in Dubai now. She's consultant haematologist at King's College Hospital, London, previous to that. And now she's here to offer her advice. We are talking general malignant haematology, thrombosis, bleeding disorders, obstetric haematology, paediatrics as well, blood transfusion, bone marrow anemia. Your list of specialties just goes on and on.
Thank you. Thank you so much for inviting me today. It's a pleasure to be here and here to answer any questions you may have.
I have lots of questions and I know everyone else is going to have lots of questions too. And as I said, you can of course message completely anonymously. Just put no name. You can make up a name. We will not know any different. I know with health it can be private and personal. So feel free to get in touch with the show completely anonymously. So, and explain bleeding and bruising. This is what I want to talk to you about. I bruise like a peach. Yeah, I always have, and I've got no idea why.
Well, you need to come and see me. I think that's a starter.
What can that be a cause of? Without alarming me live on the radio.
Yeah, no, I mean, it could be simple things. So common things being common get forgotten very easily. And I think it could just be a simple vitamin deficiency.
Probably. I think we're all deficient here, aren't we?
We are. I think that the heat and dehydration doesn't do us any favour, unfortunately. But I think sometimes with the jobs and the work that we do, we tend to neglect ourselves. And I think we as to ourselves are probably the end of the list rather than, being at the top of the list.
It's true. Busy life, busy family life.
Absolutely.
I'm also very clumsy. Doesn't help.
So
can you tell us a little bit about yourself and how did you come to work and be so interested in haematology?
So medicine is very vast. I mean, it's medicine, what you do with the patient on one-to-one on a daily basis versus surgery. But the training is in core both specialties that we get trained. It's extensive training. A lot of years go into the education, then training, and being sort of coming to sit on this seat has taken a lot of X number of years of a lot of hard work. But I think overall what it comes and boils down to is actually you looking after people and getting them better. I think that's the core of it. It doesn't change. The versatility of different specialities doesn't change this, and you want to see and make people better. Now, hematology-wise, it is very interesting, and what interests me more is the speed of things that get us to the diagnosis and actually get the patient better as well.
So do you find it rewarding in that sense that you
Absolutely.
can see screening straight away, you can see treatment straight away and recovery relatively quickly compared to other practices and specialties?
Correct. I mean, it's again, look, there is a whole vast range of things. It could be simple things and you can see a response very quickly, which is extremely satisfying. Coming to the other end, which is kind of like a lot of grim things that one has to deal with. And my speciality is blood cancers. So I do deal with a lot of that. But, mind you, within that, there's a lot of rewarding, gestures that we get back, not just from the patient, but getting them better. And when these people get better, I say somebody's got to do the hard bit. And, so I've bitten the bullet and I'm doing that. And you feel very satisfied with what you do. You see people getting better. And I think it's very rewarding.
When you say blood cancers, that would be the likes of non-Hodgkin's lymphoma or Hodgkin's lymphoma. What kind of issues are you seeing, including the cancers here in the UAE, perhaps more than you were seeing in the UK?
So here, what struck me in the last 4 to 6 months of my clinical practice, which is actually very surprising, that there is a whole vast deal of malignancy. There's a lot of cancer in UAE, and the unfortunate thing is that, a lot of it kind of gets under the cover and doesn't get brought onto the surface, and people don't do much, or if people want to do something, then doesn't get dealt with within this country.
So not to use a Dubai cliche, but we're burying our heads in the sand a bit when it comes to diagnosis.
We do, don't we? I think that's probably what would be the first reaction. I think that will be the first reaction if somebody says, look, you've had all of this work and you've got cancer. I think the first reaction, like anybody else, mine would be, no way. How can I get that? So I think we do. I think that the refusal to believe that, that's the first reaction. And then if you slowly and eventually do come to understand, then I think the speed of moving has to be taken into consideration. And we do tend to ignore our health. As I said before, it should be the other way around. We should be a top priority to ourselves.
Now, when it comes to blood disorders, what are the contributing factors here? Genetics, talking there about hectic lifestyle as well. Can you give some examples of some of those disorders and what we need to know?
So genes definitely do play a part in from simple benign disorders, simple things like bleeding and bruising, for instance. There are genes in there. We know of genetic disorders. We know of bleeding disorders like hemophilia. They run in the families. There are platelet disorders, which are one type of blood corpuscles in the blood. And not just the numbers or the quality and quantity, genes have a huge impact on these disorders. Here, again, much to my sort of surprise, not that I say I've read it in the books, it has been so far a lot of it theoretical, but when you come to such a mix of population, I'm surprised the number of inherited disorders and bleeding disorders that I've seen with mixed marriages, with Mediterranean belt, with Arab population. It's really struck me. As I said, I've moved to Dubai, to UAE very recently, but I think the enormity of the different diseases and the conditions that I'm seeing, it's actually quite mind-blowing, to be honest.
The doctor will see you now.
And the doctor here between now and 4 o'clock. We've got Shabeeha Rana. She's here from Zahra Hospital, where she's a specialist in haematology, taking your questions, and it can be anything relating to blood. She's a specialist in blood cancers. It could be anemia. It could be bruising. It could be literally, well, what are you seeing coming into clinic quite often?
Anemia.
Really?
Quite common.
Can you tell us a little bit about anemia and treatment and symptoms? What do we need to know?
So anemia is a very big topic. I mean, I could give you a lecture for days for it.
How about 30 seconds?
Yeah. So in a snapshot, anemia is effectively low hemoglobin. And that could be quite a lot of reasons. And a little bit earlier, we were talking about the genes. So they have been implicated. There are some genetic and hereditary disorders like thalassemia, for instance. We have a big Latifa hospital and the blood donation centre in Dubai. And
we do hear a lot about thalassemia in the region.
Yes.
What's that?
So that is a lot of we know that there are clusters within the geographic locations that people have certain diseases. And we know of Mediterranean region and the Arab part of the world, along with Indian subcontinent and Southeast Asian population. There are variants of thalassemia. That's a known fact. How did it start? I don't know, but it's there, and we have different types of thalassemia. Usually what I've seen prevalent within the population that I'm seeing now in the Middle East, there's a lot of beta thalassemia carrier. In the African continent, for instance, we see a lot of sickle cell thalassemia. Sometimes there's an overlap, so thalassemia with sickle cell. Then again comes to the Philippines population or people from Malaysia or Southeast Asia. They have another thalassemia called alpha thalassemia. So it's a big disorder, and talking about that, just one particular condition. The other thalassemias are just simple deficiencies of vitamins, like iron deficiency, B12 deficiency, folate deficiency, and there's a whole sort of conundrum of all of these. Effectively, if you're anemic, then we need to find out the reason, what the cause for that. If somebody's diagnosed with iron deficiency anemia, I'm not happy with that because I need to find out the reason why you're iron deficient.
It's not just a case of treating it. You've got to find root cause.
Absolutely. Because, those are very important reasons because people with iron deficiency can have an underlying quite a significant cause for this. So finding and digging out the reason is absolutely, absolutely important. And I cannot stress that more for young women and also for men over 50 years of age. If you've been diagnosed with iron deficiency, please go and see a doctor and get it checked to find a reason.
Dr. Shabeeha, we have received a question on the topic of anemia. No name on this one, saying, hi, I suffer from anemia, which gets especially bad at that time of the month. I feel exhausted and fatigued much of the time. I do take iron supplements, but is there anything else I can be doing to help?
So most likely that particular time of the month, you're losing a lot of iron. For anyone to become iron deficient is rare unless there's intake is less or you're losing a lot more than required. So usually it's the later that you end up losing lots more than your body is actually allowed to. So yes, you need to have some iron supplements to improve that, but you also need to find the reason for the loss as well, as I was just mentioning. And I think the reason for that is sometimes the bowel is where the iron gets absorbed. There are medications which can counteract the iron absorption. There are things within the bowel that will not leave the iron absorbed into the system. So that needs to be checked. The other common thing for what people don't, or misunderstand really is, taking iron at wrong times. And it's simple things like, have you had your iron this morning? Yes, doctor. What time? This morning with my cup of tea. That is not acceptable because tea and similar sort of substances actually interact and do not let iron absorbed.
So what would be the optimum kind of combination or timing to get the most out of a supplement?
So I generally recommend iron supplementation, which is in combination with vitamin B12. because your bone marrow, which is where everything comes from, needs good supplement in all of that. If you want to replace iron, I think it's crucially important that you replace the B12 and the folic acid for healthy growth of the red cells. Best time to take iron, first thing in the morning, empty stomach, with a glass of orange juice preferably. I think this I've said so many times to all my patients, and whoever knows me will probably say that, I can hear this buzzing in my head. But that is crucially important. Don't have your breakfast at least for 45 minutes to an hour after, and no tea to interact anywhere near iron. The second dose will be in the evening, just before an hour before your evening meal.
There you go. Hope that helps clear up any questions around iron and iron absorption. Jacques has been in touch saying, I'm a 43-year-old male. I've had deep vein thrombosis for a few years. Had it a few years ago, which required me to inject myself with blood thinners. What are the chances of this reoccurring in the future, and what can I do to prevent it? I fly a lot for business, and that is my major concern. So DVT, it hit the headlines numerous years ago. My father-in-law wears the stockings from ankle to thigh. Yeah. It's quite the sight when he gets off his flight in Dubai. But it can have huge medical consequences. Presumably here Jacques had to inject himself with blood thinners, so he's got to a stage where medical intervention was required. How recurrent is it?
Again, seeing it quite commonly within this country, more than what I had expected. Reasons why this could happen, again, a lot of things, genes and your own body's response to immune system, which you can just switch on anytime. But again, there are a lot of genetic factors. Simple things like dehydration, long-haul flights can actually contribute to that. And it's not just about DVT, having a pain or swelling in the leg. That can be quite a problem. And the veins are actually the tubes that carry the blood to the heart and the lungs to clean it. And if that clot travels up to the lungs, then it becomes a pulmonary embolism, which can be life-threatening. So it is a pretty serious condition. Obviously, the interventions to thin the blood is the treatment. So we used to use injections, and we still do, but then now there are a lot of newer treatments. Blood thinners have come onto the market, which we can use very easily, and no need to monitor them like good old days with warfarin that we used to. Question with regards to, for Jack in particularly, what he's asked. He's 40 with a DVT. The literature supports, and there are a lot of studies to suggest that young men around 40 years of age, 40 to 60, have a high chance of recurrence of DVT. And normally, when you have a first DVT, the first idea is to treat. We don't bother around looking for the reason. People do a lot of thrombophilia screening, which is not necessary and mandatory at diagnosis. The first thing is you find a clot, you treat. Once you treat for a specified duration of time, then you investigate once you've come off the treatment. So those few weeks of gap are rather crucial to get those blood thinners out of the system and investigate you. That is when we do all the tests to find out the reason. Now, if he hasn't had those tests done, I think now is a good opportunity that he can be tested for it if he's not on blood thinners, and we can take it from there and decide. But yes, literature does support that men around that age have a high risk for recurrent.
The region's favourite doctors, live and listening.
Doctor, give me the news.
On Afternoons with Helen Farmer.
Great to be joined in the studio by Dr. Shabeeha Rana. She is here from Zahra Hospital as we talk about all things blood related. So anemia, deep vein thrombosis, blood cancers as well. And I'm really glad you've come in because I feel like there is a lot of confusion around blood donation. Fantastic that we're seeing around the world people responding to natural disasters and terrorist attacks and wanting to do their bit to donate blood. But I feel like there's still a lot of questions around who can do it, and even do we need to know our blood type, Doctor?
Yeah, I mean, blood donation is a great gesture, and I think it's one of those things that, if you are healthy, I think we should do our bit, and everybody I would encourage to get typed and tested and donate blood. It's not a mandatory thing that you need to know your blood type before you donate, because that can be done once you've donated the blood, and we can check the type and keep it matched and safe for people who need it. But yes, if you do need to know your blood type, we can certainly do that by the bedside for you. The questions about blood donation and how often, because I think a lot of people are confused about how often can I donate. Blood, the red cells can be donated between every 8 to 12 weeks. So, it's a rough guide depending on how big or small you are. By the way, there is a age and weight cutoff. So you need to be above 17 years of age and at least 45 kilos, which is about 110 pounds. If you're below 17, then we need to have a parental consent for this. The upper limit, there isn't really, but up to 75, if you're in a healthy state, then yes, you can always walk through the doors and we can take the blood donation from you.
So we do see a lot of blood drives here, and it sounds like there is quite a large group of people that would be eligible for that. Now, something that always comes up, me being from the UK and me being from Northumberland, which was very much mad cow disease country, people who lived in certain countries during the 90s have been prevented in the past from giving blood due to that. Is that still the case?
That is still the case, unfortunately. So anybody who had transfusion in the UK between 1980s and early 2000s is prevented to give blood or blood donation. I happen to be coming from UK as well, and I know very well about this scare when the mad cow disease was a lot of talked about. And I think the main concern really is that was it just the blood or blood-related products as well. So even the implication is when you do donate blood, we screen the blood, we sieve it. That's probably the easiest way I can put it, is we take the red blood cells out, we separate the platelets, we separate the plasma. And not just the blood or the red cells, it's also the plasma and the platelets can be of risk as well. So we do take that as a very big threat for transfusion. And in the 80s, if you remember the good old days when I was in school, this was all in the budding that HIV was getting quite common and hepatitis C. And a lot of haemophilia patients, unfortunately, ended up having all these diseases because of contamination of blood. So, all these risks are there to prevent. And mad cow is essentially a typical, very scary disease called variant Creutzfeldt-Jakob disease.
Glad you said that, not me.
Yeah. So VCJD. But that actually is obviously quite a threat to anybody's system. And that's why we still keep those patients off the list to donate blood.
Shabeeha joining us until 4 o'clock this afternoon. And have you had a coffee? Are you ready? Yes.
I'm ready.
Okay. We're going to get through as many as we can. Sana's saying, my 8-year-old son is very active, plays a lot of sport, and he seems to bruise extremely easily and they last for ages. Should I get him checked? And is this something I need to worry about?
So I think the first thing I'd say, yes, you do need to get him checked. I think in this day and age, nobody should sit on any symptom. I think there's great advances in medicine and health is a right. So you do get it checked. What would be some that will turn out of it? I don't know. Obviously, depends. Simple things, as I was mentioning to you. Kids do end up bruising, grazing themselves very easily compared to older, clumsy adults. So I think that needs to be borne in mind. But I think because he's a boy, he's young. And if you are seeing him, coming up with bruises, then I think you do need to get him checked.
Andrea is saying, I had to have a blood transfusion after having my son 9 days ago. Congratulations on your new baby. She says, I really want to breastfeed and have been doing so, but I don't have much milk at all. I think I do recall the doctor saying there might be a delay in my milk coming in properly, which is typical after transfusion. But to be honest, it's all a bit of a blur. Any advice, please?
Yeah, no, I think there are two different systems here altogether. I think the breast or the milk delay is a separate issue altogether. So mastitis, sort of local inflammation of the breast, is a commonest cause. It does happen after childbirth. Blood transfusion has nothing to do with that greatly.
So do go and check out a lactation consultant if you do want to breastfeed. And stress, of course, doesn't help.
No, exactly.
So if you have had a difficult birth and subsequent blood transfusion, that may well be related on that front.
Absolutely.
But yeah, huge congratulations, Andrea. And no name on this one saying, I've been referred to the haematology specialist, aka Dr. Shabeeha, as my white blood cells are low. It's medication related. What will happen at the appointment?
So white blood cells are the other types of corpuscles in the blood that are made in the bone marrow. And there are, again, a lot of reasons for white blood cells to be low. Simple things as virus infections, medication, different drugs, or some of more sinister causes. I think it is important that you do visit your specialist and see, because there's a lot broader scope that we need to exclude than actually just to say, just to put the comfort blanket on, this could be drug related, is probably not just enough. Just get it checked, please.
The doctor will see you now.
And that doctor is Dr. Shabeeha Rana. She's here from Zahra Hospital and we're talking about haematology. Her specialists are wide-ranging, but it's basically all about blood. Can we go back to blood cancers, please, doctor? What comes under the blood cancer umbrella that you see and you treat?
So blood cancers are a wide specialist area. There is Hodgkin's and non-Hodgkin's lymphoma that people know a lot more about, and say that they've encountered either in part in the family or a friend.
Yeah, my dad had it.
Yeah, so I think it's one of the commonest sort of blood malignancies or cancers, I can say.
And non-Hodgkin's you do see quite a lot in younger people as well.
We do. Non-Hodgkin's, again, whatever I'm talking about, it seems to be another area. It's a big dominoes that you start one thing and it ends up being a big area to cover. So non-Hodgkin's entails a lot of blood lymphoma types. So there are simple things as, what we call the B-cell malignancies. They're coming in under the umbrella. So non-Hodgkin's can be simple, sitting in the background, not actually bothering anybody, maybe a lump here and there, probably more commonplace in the neck or just above your collarbone, sometimes under the arm or in the groins. It's usual things that, one can actually feel in the shower and just find out. If you have a lump, please go and see a doctor if it's more than 2 centimeters size big, about a grape size or slightly bigger. And then these could be just sitting there, not actually causing any problems. Sometimes if it actually starts to do any trouble, then we can treat it with simple things, probably radiotherapy. If it changes its behavior, then there are other options, including chemotherapy, available, which is the mainstay for treatment of these patients. Then there is another category of Hodgkin's lymphoma. So again, lumps are the commoner things. The side that people do get scared about, the word called leukemia. So I think that again, with the notion that there is a chronic type of leukemia and there's acute type of leukemia. So acute leukemia is more of a concern that it's a very rapidly progressing disease course and it's life-threatening if it's not treated. We can pick that up with a full blood count and patient's presentation. So simple things as getting tired is a very common example. And I think everybody, all of us sitting around this table today are
and everybody
tired.
listening tired.
Yeah, so everybody's tired at the end of the day or most of the time. Simple infections, which are coming more frequently than usual and not getting better, or bleeding and bruising. So all these things, I think one of those things we may all have encountered at some stage of life, which is where I think getting it checked is very important. The chronic leukemias are, because the word leukemia is quite a fooling word, and I love the Greeks when they named this, that, it threatens and it, just kills everybody before they actually listen to what's coming next. So chronic leukemia is not going to kill you. It is something which is slow, rumbling, sitting in the background. When it changes behavior, it does need treatment, and that's that, and can be taken care of. But I think the word leukemia is true in its fact is actually acute leukemia.
Any questions, it's your last chance to get them in to the doctor in the studio, 4001. You can use the Dubai Eye app. We're going to get through as many as we can between now and 4. And Harsh has been in touch saying, I had blood taken last week. I've got thin veins, but the nurse didn't comment on this, although afterwards she did make the unprompted comment, I hope you don't bruise. I didn't say anything, but she did recognise that getting blood from me is not easy. Anyway, I did bruise, not oddly at the puncture site, but randomly around the lower arm. Arm has been sore ever since, mainly around the bruising, but last night I woke up in pain in my upper arm. It felt like there was a band being squeezed around it hard, and my lower arm and hand felt slightly numb, like a cold sensation. At 6 a.m. I took 2 paracetamol, pain gradually went away, came back at 12 today and I took 2 more. I'm worried if I have a clot or something else is wrong because the blood test was nearly a week ago. The original bruising is fading, so why has the pain stepped up?
So it could be common, again, after any stab. So it's a puncture in the veins, and the veins can be inflamed, causing the pain as to exactly what she's describing in the lower arm. The feeling of the pain around the upper arm, the course of the veins is they take blood from the fingers up to the heart, which is in the anti-direction of what one would say. So it could be inflammation going from the site of bleeding upwards, and it is typically seen after a puncture if it is traumatic. And, she did probably squeeze one of the veins which went through. It could be the inflammation which is causing it, but do get it checked. A scan for the arm is an easier way to find this out.
Okay, I hope that helps, Harsha. And no name on this one. And really sorry to receive this news, saying I had a miscarriage nearly 2 weeks ago, and a few days later my blood pressure was 100/56, so low. It's normally at the lowish end number, around 60. However, yes, I went to doctors complaining of feeling dizzy, shaky and faint, and she said it would be due to my low blood pressure. But she did the reading and it was high, 149/89. It has never been above the 60s on the bottom number. She was concerned I need to go back next week. Is it stress? Can a miscarriage cause high blood pressure? Could they be related?
I think it's the loop. If I try and connect the dots, is probably the miscarriage, unfortunately. I'm really sorry to hear that. Probably the miscarriage causing the stress and pushing the blood pressure rather than the other way around.
So wishing you all the best with your recovery there. And at Zahra, you're doing a lot around awareness
cancer,
and blood
yes.
cancer awareness. What do we need to know and how can people get involved?
So September is the month for blood cancer awareness, and we are celebrating that, just making people aware of the blood cancer and any blood-related problems to seek the specialist. I mean, I'm here working and practicing, and people can walk in and put their questions. I mean, there are multiple websites, social media websites, and we can address those questions on that. The concern really is that we are driving a blood donation drive on the same day, and this is 14th of September. So please mark this date in your diaries, in your calendars, in your iPhones, with an alarm. So 14th of September at 10 a.m. at Zahra Hospital, we are arranging a blood cancer awareness day along with a blood donation drive. So please walk along, do your bit, donate blood, be healthy, donate love, donate life. That would be great.
When it comes to coming along and donating, do people need to bring any medical documentation? What do they need to come armed with?
So any of their medical history would be extremely useful. The medication they're on. So people who are on blood thinners, I know it is very generous of people to even think about donating blood, but if you are on something which will take you out of the blood donation list, you have to be careful. So we will not take the blood for such people. Your health is a priority for us, but do bring your medication list and your medical record just for us to make sure you're healthy and happy.
Dr. Shabeeha, thank you so much for coming in, sharing your expertise and
My pleasure.
advice.
Thank you so much.
This is Dubai Eye 103.8.